Let's talk about what we got on the schedule today.
Today we have Holly coming in at 1 o'clock.
Okay. So the majority of patients that I see in my practice are male patients with the old age problem of male pattern baldness. But hair loss affects men and women.
My name is Holly, I'm 34, and I have a secret. I have made myself essentially bald on the top of my head, one hair at a time, over 20 years. Yep, there it is. I suffer from trichotillomania. That is a body-focused repetitive disorder in the form of hair pulling, specifically from my scalp. Always from the crown or from these two patches right here. It's a very meticulous process, one hair at a time. I was a very happy child and I had a good home life. But I have OCD and anxiety. I also struggle with intrusive thoughts. So that creates this perfect trifecta that just like, they all feed off of each other and you get stuck in these loops. By the time I was 4, I was already biting my nails. And by the time I was 11, it had progressed to hair pulling. I just grabbed like 3 or 4 hairs that were right there and just kind of yanked them out. And I had never done that before, and it felt incredible. I imagine that's what heroin must feel like. It is intoxicating. It's definitely something going on neurologically. When I started in junior high, I had already learned how to disguise any bald spots or scabs on my head by wearing my hair up or halfway down, or just making sure that the ponytail was tight all the time. I finally got my first hair topper when I was 20, and that was actually life-changing. I probably could have paid for a couple years of college with the amount that I have spent on hair, trying to look like I just have normal hair. But even though the hair toppers provided me some relief, they became an issue on their own. This part is just not satisfactory. It quickly triggered my OCD and I was like, no, no, no. The hair toppers have to look absolutely perfect and the part has to be perfectly lined up and the hair has to be all flat, and if it's moving around, it's gonna look fake and people are gonna know I have fake hair. And it's exhausting. If something goes wrong and someone's like, whoa, is your hair fake? Like the absolute dreaded question, the absolute dreaded question. I've looked up hair transplants because the hair regrowth had stopped happening. I think I've caused so much damage that it's not gonna come back. So I came across Dr. Endži and I am hoping that she's able to help me.
It's important to see someone's whole face when we're doing a hair restoration procedure. And in the era of COVID, that can be a little harder to do because everybody's wearing a mask. So I'm trying to see my patients outside as much as I can so that I can get a better idea of the proportions of their face for the hair restoration procedure. Hi there.
Hi, I'm Holly.
Hi, Miss Holly. I'm Dr. Endži Fips.
So nice to meet you.
Nice to meet you too. Let's move upstairs to the office,
Sounds
okay?
good.
All right. With patients who have trichotillomania, we have to make sure they have the psychological tools in place to resist that urge to pull their hair. Okay, we're gonna get a little bit personal now.
Okay.
She might not be ready for this procedure. So it's time to ask Holly the tough questions about her mental health. So when is the last time that you actually pulled?
It's been about a year. Last year, things really improved for me, just my ability to deal with my own triggers and through therapy, and it's been significantly improved since then.
Okay, I would like you to take your hair down so I can actually see the area of hair loss.
Okay.
All right, let's take a peek. To do a hair restoration procedure, we take a strip of tissue in the back of the head called the donor area, and then we replace those hairs into the balding area called the recipient area. If she's approved, what we're going to be doing is removing a piece of tissue out of the back of Holly's head that contains all the hair follicles, and then we'll individually dissect each individual hair follicle out one by one. Then I will make incisions into the area where the balding has occurred and then place the individual hair follicles in those incisions one by one until the procedure is completed. However, I still have to evaluate her donor hair area, so we don't know whether we're going to be able to do surgery today yet or not. Okay, let's take a look. Your scalp looks very healthy, actually. There's no inflammation, there's no redness, I don't see any dryness, any scaling. So now I need to evaluate what we call the donor hair. So what I'm doing is I'm gonna measure the length that we would make the incision so I can calculate how many grafts I think we can harvest. So a normal estimation of hair follicles that can be harvested from a female is generally between 1,500 and 2,000. But Holly has a large bald spot. If we only get out 1,600, 1,600 is not going to cover her whole bald head. So that's 20. It's 25.
The idea that I might have a full head of hair, which I haven't had since I was 11 years old, I can't even explain what that feels like. I'd be able to ride a roller coaster or go in a car with the windows down without freaking out mentally. It would be a completely different world for me.
Hey Jess, what's on the schedule today?
So we have a patient named Vaughn. She's coming in for alopecia areata.
Oh, okay, so she already has a diagnosis there.
Yes.
Oh, okay. Can't wait to see her.
So alopecia areata is a condition in which your T cells, which are cells of your immune system, start to attack your hair follicles, and then the hair falls out of the follicles that are being attacked. It's definitely not easy to treat, as its course can be kind of like a roller coaster.
Vaughn?
Yes.
Right over here. Hi, how are you? Good, how are you doing?
My name is Vaughn. I am from Garland, Texas. I'm a single mom, and I have alopecia areata. I had long hair all my life. It used to be down to my waist. When the pandemic hit, I saw a spot on top of my head like a quarter size. I remembered being really stressed. We were locked in, couldn't go anywhere. I lost my job. I couldn't get unemployment for a while. I couldn't pay rent. I felt like everything was piling up. All my hair started to come off like right on the top of the crown area. And then it just kept getting worse and worse and worse. My son, he was confused of why my hair was falling out. He was a little scared. And he asked me if I was okay. And I said, I'm fine. But then I would hide in my closet and just cry. My hair, it was part of me, my identity. And now that it's gone, I look in the mirror, I don't want to look at myself.
All right, we're gonna be right in this room. Go ahead and take a seat on that green chair.
Okay.
And I'll call Dr. Lopez in, okay?
Okay. The last time I saw a dermatologist was last year in the summer. She just told me I had alopecia. She gave me steroid injections for my scalp, and it was super painful. After that, new hair came in, but then after like another 3 weeks, more hair will fall out. So I've been through a lot going through this hair loss journey. I hope that Dr. Lopez can help and that it's not too late, because if my hair does grow back, then I feel like I can get my life back.
Hi, hello, is it Vaughn?
Yes, you got
Nice
it
to
right.
meet you. I'm
Nice to meet
Dr.
you.
Lopez. So, what brings you in today?
So I'm experiencing hair loss at the moment.
Okay, so when did this all start?
Right when the pandemic hit,
Uh-huh.
so I just started coming out in chunks.
You know, that's not an uncommon story. We are seeing a lot of hair loss because of the pandemic, because of COVID
Oh, really?
itself. It's really taken a toll on people's mental state, which can take a toll on your body. Stress on the body can manifest in many ways. You know, it can lower your immune system. And so that can be manifested in hair loss. And I think as dermatologists, we've been seeing a lot of hair loss post-COVID. The pandemic has, we've never experienced a pandemic, right? And so
It's scary.
It's scary. So I lost my grandma to COVID last year. And so I feel like, you know, the stress, the pandemic has affected everybody. So for Vaughn, I just can see her pain and how she's manifested that fear and anxiety through a medical condition, and how cruel this pandemic is, how cruel COVID is.
So if you don't mind, if I would take a look.
Okay.
Okay, so let me grab some gloves really quick.
One thing that we notice classically in alopecia areata are round patches of hair loss, and they're all kind of at the same stage. So whenever I take out my dermatoscope, which is like my magnifier glass, it helps me to look at the follicles, helps me to look at the hair. And so we're able to kind of see alopecia areata signs on the scalp that leads us to that diagnosis. You have maybe a good 60 to 70% hair loss. Once I examined Vaughn's scalp, I did agree with her previous diagnosis of alopecia areata, and she is experiencing a severe amount of hair loss. So Vaughn, I think that we can regrow your hair. That's the good news. I think you're still very early in your presentation, though you have, you know, more moderate to severe alopecia areata or AA. I still think you're in a good time frame to actually intervene.
Okay. I'm so relieved that Dr. Lopez can help me out. I just hope there's no needles involved because I don't like needles.
So in alopecia areata, we think that there are triggers that cause your immune system to start fighting your hair follicle. And usually hair follicles are protected from our immune system. Our immune system doesn't usually target our hair follicle. But in certain people who have a predisposition to developing alopecia areata, they usually have a history of autoimmune diseases. And for some reason, a trigger happens, and that trigger causes your immune system to think that this is foreign, and it attacks.
Okay.
And so when it attacks it, it causes inflammation around the hair follicle, and that's why the hair starts falling out. It's not curable, but it's treatable. There are two factors in treating alopecia areata: reducing inflammation and promoting hair growth. So a lot of treatments do one or the other, but there is an experimental treatment that may do both. So platelet-rich plasma is something that we're seeing can help patients with alopecia areata or AA. We draw your blood, and then we take out the pro-inflammatory stuff and leave the platelets behind, and it comes out in plasma. And we inject that part that has the growth factors into your scalp.
I don't like needles. I tried injections, and it was super painful. I cried through it. Like, I don't want to do needles no more.
So we have our next patient that's coming in. I've seen his YouTube. I think he may be one of the hairiest people I've ever seen.
I'm getting ready to clean the bathtub, but I just want to show you all the hairs that are left in the bathtub after Devin showers. It's you.
My name's Devin. I'm 39 years old, and my hair is literally my identity to me.
The sign of a hairy man.
I was pretty much bald by the time I was like 19 or 20, so having a lot of body hair. There's like a hidden like superpower underneath my shirt. But having this hair is becoming a problem. It's causing a skin condition that, you know, I would like to have go away and yet still keep this beautiful, luscious hair. I started growing body hair from a very young age. I think by the time I was 10 or 11, there was like a line of chest hair. And I think by the time I was like 12, like it just went whew. By the time I was in 8th grade, I had sideburns, probably like all of 8th grade. Like by the time, like end of 7th grade and going into 8th grade, I mean, I was sideburned from the age 13 on. I remember one time there was like a swimming party, just took off my shirt and like almost like audible gasp and just like almost shock, I guess. You have anything you want to say? I'm going to the doctor.
To Kansas City.
That's right.
Kansas City, here I come.
Any concerns?
My concern is that you're gonna come back like completely shaved.
The idea of him removing all of his body hair, at least on his chest and back, permanently to alleviate a skin condition, that seems extreme to me.
Today I'm gonna go see Dr. Meena Singh, and hopefully she's gonna help me manage this skin condition without removing all my body hair permanently. Howdy.
Hey, how are you?
I'm good, how are you doing?
I'm good. Are you Devin?
I sure am.
Devin, I'm Ryan.
Ryan.
Nice to meet you. Let me
right.
come on back here.
All right, man. I used to have a beard, but started to notice some facial redness, irritation, so I had to get rid of it.
Have a seat.
And then probably within a year or so after that, I noticed it was in my chest hair. There's skin redness, irritation, itching. At its worst, there's scaling. So scaling is the skin falling off. Even as recently as this week, I had like a piece of skin fall off my face as I was at work, and I just like, you know, I'm like, oh, and it's really embarrassing. A dermatologist has told me there's a correlation with being hairy and with this skin condition. But I do not want to lose all my body hair. That would be heartbreaking.